Mild cognitive impairment, or MCI, is a condition in which people have more memory or thinking problems than others their age. MCI risk increases as a person gets older. Genetic variations and certain health conditions, such as diabetes, depression, and stroke, can also increase a person's risk. Signs of MCI may include losing things often, forgetting important events or appointments, and having more trouble coming up with words than other people of the same age. The symptoms of MCI are typically more serious than normal changes that occur with memory and thinking as people age. However, they are not as severe as dementia symptoms. If you or a loved one is experiencing changes in memory or thinking, a doctor can help. A doctor can perform tests to determine whether changes in memory or thinking are MCI or caused by other factors, such as side effects from a medication or sleep problems. A doctor may suggest that you see someone who specializes in the diagnosis of memory disorders, such as a neurologist, psychiatrist, or neuropsychologist. There is currently no standard treatment or medication for MCI, but there are things you can do to help deal with changes in your memory and thinking, such as following a daily routine, planning tasks, making to-do lists, and using memory tools such as calendars and notes, exercising and eating well, learning a new skill, spending time with friends and family, and getting enough sleep, generally 7 to 9 hours each night. If you are diagnosed with MCI, it's important to see a doctor every 6 to 12 months. They can track any changes in your memory and thinking skills over time. Keeping a record of any changes you or your loved ones notice can also be helpful. People with MCI are at higher risk of developing Alzheimer's or other dementias. However, in many cases, people's symptoms stay the same or may even improve over time. People with MCI, their caregivers, and healthy volunteers may want to consider participating in research by joining a clinical trial or study. Research studies test whether potential treatments are safe and effective in people. Taking part in clinical trials may help people with MCI, their families, or future generations. To learn more about mild cognitive impairment, visit www.alzheimers.gov/MCI.